Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on diabetes and eye problems or complications. So let us discuss now. What is diabetic eye disease? Diabetic eye disease is a group of eye problems that can affect people with diabetes. These conditions include diabetic retinopathy, diabetic macular edema, cataracts, and glaucoma. Over time, diabetes can cause damage to your eyes that can lead to poor vision or even blindness. But you can take steps to prevent diabetic eye disease or keep it from getting worse by taking care of your diabetes. The best way to manage your diabetes and keep your eyes healthy are to manage your blood glucose, blood pressure, and cholesterol, sometimes called the diabetes ABCs. If you smoke, get help to quit a smoking. Have a detailed eye exam once a year. Your eyes may seem fine, but having a full dilated eye exam is the only way to know for sure. Often there are no warning signs of diabetic eye disease or vision loss when damage first develops. A full detailed dilated eye exam helps your doctor find and treat eye problem early, often before much vision loss can occur. How does diabetes affect my eyes? Diabetes affects your eyes when your blood glucose, also your blood sugar, is too high. In the short term, you are not likely to have vision loss from high blood glucose. People sometimes have blurry vision for a few days or weeks when they are changing their diabetes care plan or medicines. High glucose can change fluid levels or cause swelling in the tissues of your eyes that may help you to focus, causing blurred vision. This type of blurry vision is temporary and goes away when your glucose level gets closer to normal. If your blood glucose stays high over time, it can damage the tiny blood vessels in the back of your eye, retina. That damages can begin during the pre-diabetes when blood glucose is higher than normal but not high enough for you to be diagnosed with diabetes. Damaged blood vessels may leak fluids and cause swelling. New weak blood vessels may also begin to grow. These blood vessels can bleed into the middle part of the eye, leading to scarring or cause dangerously high pressure inside your eye, causing the glaucoma. More serious diabetic eye disease begin with blood vessels problem. The four eye diseases that can threaten your sight are diabetic retinopathy, the retina, the inner lining at the back of your eye. The retina senses light and turns into the signal that your brain decodes so that you can see the world around you. Damaged blood vessels can harm the retina, causing a disease called diabetic retinopathy. In early diabetic retinopathy, blood vessels can weaken, bulge, or leak into the retina. This is called as non-proliferative diabetic retinopathy. If the disease gets worse, some blood vessels close off, which causes new blood vessels to grow or proliferate on the surface of the retina. This stage is called proliferative diabetic retinopathy, and these abnormal new blood vessels can lead to serious vision problems. Then diabetic macular edema, the part of your retina that you need for reading, driving, and seeing faces is called the macula. Diabetes can lead to swelling in the macula, which is called diabetic macular edema. Over time, the disease can destroy the sharp vision in this part of the eye, leading to partial vision loss or blindness. Macular edema usually develops in people who already have other signs of diabetic retinopathy. Then the glaucoma. Glaucoma is a group of eye diseases that can damage to the optic nerve, the bundle of nerves that connects the eye to the brain. And diabetes doubles the chances of having glaucoma, which can lead to vision loss and blindness if not treated early. Symptoms depend on which type of glaucoma you have. And then is the cataracts. The lens within your eyes are clear structures that help provide sharp vision, but they tend to become cloudy as we age. People with diabetes are more likely to develop cloudy lenses called cataracts. People with diabetes can develop cataract at an earlier age than people without diabetes. Researchers think that the high glucose levels cause deposit to build up in the lenses of your eyes. So cloudy vision and faded colors are symptoms of cataracts. How common is diabetic eye disease? Diabetic retinopathy, one in three people with diabetes who are older than age 40 already have some signs of diabetic retinopathy. Retinopathy is the most common cause of vision loss in people with diabetes. Each person's outlook for the future, however, depends in large part on regular care. Finding and treating diabetic retinopathy early can reduce the risk of blindness by 95%. Then glaucoma and cataracts. Your chances of developing glaucoma or cataracts is about twice that of someone without the diabetes. Who is more likely to develop diabetic eye disease? Anyone with the diabetes can develop diabetic eye disease. Your risk is greater with high blood glucose that is not treated and high blood pressure that is not being treated. High blood cholesterol and smoking may also raise your risk for diabetic eye disease. Some groups are affected more than others, and African Americans, American Indians, and Alaska Natives, Hispanics, Latinos, Pacific Islanders, and older adults are at a greater risk of losing the vision or going blind from diabetes. If you have diabetes and become pregnant, you can develop eye problems very quickly during your pregnancy. If you already have some diabetic retinopathy, it can get worse during pregnancy. Changes that help your body support a growing baby may put stress on the blood vessels in your eyes. Your healthcare team will suggest regular eye exam during pregnancy to catch and treat problems early and protect your vision. Diabetes that occurs only during pregnancy, called gestational diabetes, does not usually cause eye problems. Researchers are not sure why this is the case. Your chances of developing diabetic eye disease increase the longer you have diabetes. What are the symptoms of diabetic eye disease? Often there are no early symptoms of diabetic eye disease. You may have no pain or no changes in your vision as damage begins to grow inside your eyes, particularly with diabetic retinopathy. When symptoms do occur, they may include blurry or wavy vision, frequently changing vision, sometimes from day to day, dark areas or vision loss, poor color vision, and a spot or dark strings called floaters, and flashes of light. Talk with your eye doctor if you have any of these symptoms. When should I see a doctor right away? Call a doctor right away if you notice sudden changes of your vision, including flashes of light or many or more spots floaters than usual. You also should see a doctor right away if it look like a curtain is pulled over your eyes. These changes in your sight can be symptoms of a detached retina, which is a medical emergency. How do doctors diagnose eye problems from diabetes? Having a full dilated eye exam is the best way to check for eye problems for diabetes. Your doctor will place drops in your eyes, pilocarpine, to widen your pupil, and this allows the doctor to examine a large area at the back of each eye. Using a Madrasil is being given, and using a special magnifying lens, he will see your vision will be blurry for a few hours after a dilated exam. Your doctor will also test your vision, measure the pressure in your eyes. The doctor may suggest other tests too, depending on your health history. CT scan of the orbit. And most people with diabetes should see an eye care professional once a year for a complete eye exam. Your own healthcare team may suggest a different plan based on your type of diabetes and the time since you were first diagnosed. The eye exam guidelines for diabetes are type 1 yearly eye exam should start within 5 years of diagnosis, and for type 2 yearly eye exam should start right after diagnosis. And pregnancy, women with type 1 and type 2 diabetes need an eye examination before pregnancy or within the first 3 months. Your doctor may want you to repeat the exam later in your pregnancy and until your baby is 1 year old. Women who develop gestational diabetes do not usually need an eye exam because they do not develop diabetic eye disease during pregnancy. If you have any questions, ask your doctor. How doctors treat the diabetic disease? Your doctor may recommend having eye exams more often than once a year along with management of your diabetes. This means managing your diabetes ABCs, which include your HbA1c's, blood pressures and cholesterol levels, and quitting smoking. Ask your healthcare team what you can do to reach your goals. Management of blood glucose can help prevent diabetic eye disease and keep it from getting worse. Doctors may treat advanced eye problems with medicine, laser treatment, surgery, or a combination of these options. Medicines: your doctor may treat your eyes with anti-VEGF medicines such as aflibercept, bevacizumab, or ranibizumab. These medicines block the growth of abnormal blood vessels in the eye. Anti-VEGF medicines can also stop fluid leaks, which can help treat diabetic macular edema. The doctor will inject an anti-VEGF medicine into your eyes during office visits. You will have several treatments during the first few months, then fewer treatments after you finish the first round of the therapy. Your doctor will use medicine to numb your eyes so you don't feel pain. The needle is about the thickness of a human hair. Anti-VEGF treatment can stop further vision loss and may improve vision in some people. So ranibizumab and bevacizumab and aflibercept are being used as anti-VEGF medicines for stopping further vision loss. And then is the laser treatment. Laser treatment, also called as photocoagulation, creates tiny burns inside the eye with the beam of light. This method treats leaky blood vessels and extra fluid called edema. Your doctor usually provides this treatment during several office visits using medicine to numb your eyes. Laser treatment can help eye disease from getting worse, which is important to prevent vision loss or blindness. But laser treatment is less likely to bring back vision you have already lost compared with anti-VEGF medicines. There are two types of laser treatment. Focal grid laser treatment works on a small area of the retina to treat diabetic macular edema, and the scatter laser treatment, also called pan-retinal photocoagulation (PRP), covers a large area of the retina. This method treats the growth of abnormal blood vessels called proliferative diabetic retinopathy. Then vitrectomy. Vitrectomy is a surgery to remove the clear gel that fills the center of the eye called the vitreous gel. This procedure treats problems with severe bleeding or scar tissue caused by proliferative diabetic retinopathy. Scar tissue can force the retina to peel away from the tissue beneath it, like wallpaper peeling away from a wall. A retina that comes completely loose or detaches can cause blindness. During vitrectomy, a clear salt solution is gently pumped into the eye to maintain eye pressure during surgery and to replace the removed vitreous. Vitrectomy is done in a surgery center or hospital with pain medicine. Cataract lens surgery is being done in a surgery center or hospital visit. Your doctor can remove the cloudy lens in your eye where the cataract has grown and replace it with an artificial lens. People who have cataract surgery generally have better vision afterward. After your eye heals, you may need a new prescription for your glasses. Your vision following cataract surgery may also depend on treating any damage from diabetic retinopathy or macular edema. What can I do to protect my eyes? To prevent diabetic eye disease or keep it from getting worse? Manage your diabetes ABCs, your HbA1c, blood pressure and cholesterol, and quit smoking if you smoke. And if you have a dilated eye exam at least once a year or more often if recommended by your eye care professional. These actions are powerful ways to protect the health of your eyes and prevent the blindness. And this was all about diabetes and eye problems. And I hope so that this video will be more informative for the audience. And if you have liked this video, then kindly subscribe my channel and share this video with other individuals as well. Have a wonderful nice day. Thank you very much.